years, the Behavioral Health Initiative has successfully researched, proposed, funded, and launched more than 20 programs. So collectively, these programs have infused our behavioral health care system. And altogether, more than 52,700 people have benefited from this program. So today we're honored to make yet another behavioral health initiative announcement. So officially, to make the announcement, I'd like to ask our Vice Chair of the County Commission, Debbie O'Malley, to come up to the podium. Commissioner.
Well, good morning, everyone, and I also want to thank you all for being here today. Today is a momentous day for Bernalillo County and our community. This long-awaited crisis stabilization unit is phase one of our efforts with the University of New Mexico hospitals to create a crisis system and bolster services throughout the community. Licensed as a crisis triage center, it'll have 16 beds that'll create a level of behavioral health care that has previously not existed in our community. We anticipate serving approximately 360 people every year at full capacity. This center will serve individuals who do not meet the criteria for inpatient services, but are in need of stabilization and support. And I'm honored to be here today to celebrate this opening and to recognize all the effort that went behind putting it forward.
This is a really big lift, and we're really excited to be here today. As was mentioned, it's not as easy as snapping your fingers and making it happen. There are countless hours at the legislature to work to amend laws, countless hours working on analyzing budget, leveraging other funding sources, renovations, right? We had to do renovations on our campus, and I want to recognize Studio Southwest and county facilities who's really stepped up and helped us to make this a reality and make it fit the needs in the community.
And as mentioned, this would serve a need that is non-existent. We have inpatient care, but many patients could be discharged, but not directly into the community. They need a step before that, and this is what this service will be about.
We can't wait to start seeing the difference. And this Crisis Triage Center, as Dr. Towen mentioned, will really make a difference in that crisis continuum.
I also wanted to acknowledge, and she's not here, Commissioner, our Chair of the Commission, Commissioner Maggie Hart-Stebbins. She couldn't be here with us today. Again, she's been the champion for this initiative. She's been totally supportive, and we just want to thank her too. So, Commissioner, I know you're not here, but thank you, Commissioner.
I want to talk to you briefly about the process and how this really will address that gap. So right now, an individual in the community who experiences a mental health crisis traditionally either calls 911 or themselves or their family takes them to an ED, right? We all know somebody who's experienced that process. But they go to the ED, and more often than not, they don't meet eligibility for inpatient services. So that client is discharged, they go home, and then there's a gap between the time they can get to outpatient services. This addresses that gap. Now, something that's really exciting is that this facility's main building will be renamed in honor of one of our community advocates and community members who has graciously led our Addiction Treatment Advisory Board and given us guidance on so many occasions, including researching best practices on behalf of the county, and most importantly, he always answers my call. He has dedicated his life to public health with a very impressive CV that includes being a professor, multiple leadership roles at the University of New Mexico hospitals, chairing the Addiction Treatment Advisory Board, and volunteering on the Opioid Accountability Initiative. So Dr. William Weiss is selected today for us to rename our program. Our main building that you are all in right now is now the Dr. William H. Weiss Resiliency Center. So we're excited to have that named after him.
If we're going to have an impact on the ability to really help people emerge from the clutches of these behavioral health problems. Dr. Towen said these are lifetime problems. But if these people are going to be able to return to productive lives, productive families, and be well with their diseases, that's going to require a real change in terms of how our systems work together across the board.
So thank you to all of you here. We're excited to cut the ribbon, literally, not figuratively, but literally, cut the ribbon to the Crisis Triage Center. We are excited to provide crisis stabilization in the community. 2, 3.